Greetings. Let us talk about the role of epinephrine injection in GI endoscopy. These are my acknowledgements, and the learning objectives are: first, learn about the purpose of epinephrine injection in the management of various gastrointestinal disorders, and then how do you actually inject epinephrine injection. So epinephrine is available in different concentrations, but the solution that we use for injection is anywhere between 1 in 10,000 dilution or to as high as 1 in 100,000 dilution. For most cases of bleeding control, we prefer to use 1 in 10,000 epinephrine dilution. And whenever you prepare a solution of epinephrine, it is important to label the syringe, label the container that has that epinephrine solution, and label it by the concentration, date, time, and make sure you put your initial. Next, you take an injection catheter. We talked about how to use an injection catheter in a previous video. And let us talk about some do's about epinephrine injection, especially the precautions you need to take when you're using an injection catheter. Let's talk about the do's. Make sure you check the syringe that is filled with epinephrine, that there are no bubbles in there. Next, check the injection catheter function, i.e., whether you can move the needle in and out of the sheath easily. Needle in, needle out. Make sure you check that. Attach the syringe to the injection catheter and make sure you hold the syringe down. By keeping it down, you avoid accidentally injecting bubbles. Prime the catheter with epinephrine and make sure you give the catheter to the endoscopist with the needle in, i.e., retracted into the sheath. That way you are not going to cause any accidental injury to the endoscopist. This is very important. And when you inject any solution, especially epinephrine injection, do not forget to count the amount of epinephrine injection that you're injecting very, very loudly. 1 cc of epi gone in, 2 cc's of epi gone in, 3 cc's of epi gone in. So it's very important that the endoscopist knows how much of fluid you're injecting so that he can decide how much he wants to deliver in. So now let us talk about where all can we use epinephrine injection. It has been used widely in the control of peptic ulcer bleeding, and it has also been used in the management of diverticular bleeding, where epinephrine is injected into the site of bleeding to control bleeding. In patients undergoing large polypectomies, injecting into the stomach causes vasospasm and decreases the size of the polyp and allows for a safer cut. It does not prevent delayed bleeding. It's also been used to control a brisk bleeding where you have tough time to use any other modality. To slow down that bleeding, you can consider injecting epinephrine. Whether it is peptic ulcer bleeding, diverticular bleeding, post polypectomy bleeding, it is important to keep in mind that epinephrine injection slows down the bleeding. Maybe in some cases it can arrest the bleeding, but you have to make sure that you apply additional hemostatic measures, either application of a clip or using a thermal device to seal the blood vessel. Without that, the patient is going to rebleed. We don't want that. And what are the concerns of epinephrine injection? In an elderly patient, one should be careful, and as epinephrine is being injected, it is a good idea to keep an eye on what is happening to his heart rate, his electrical rhythm, and also to his blood pressure, as patients can develop cardiac arrhythmias as well as hypertension. If you're injecting epinephrine and the anesthesiologist is helping you with the procedure, it is a good idea to share that epinephrine is being injected so that the anesthesiologist could prepare for some of the adverse effects of epinephrine injection. In summary, we talked about the use of epinephrine injection, the concentration of 1 in 10,000 for hemostasis, and maybe a little more dilute version for other indications, and how to prepare the syringe, how to use the injection, keeping in mind to count loudly the amount of fluid that has gone in by every cc, and also to keep in mind that patients can develop side effects, and it's important to do additional therapy after controlling bleeding for a good, safe, effective hemostasis. I hope this has been useful. Thank you.